Well, and the other thing that I think was unique that y'all do was the brain scanning part of it.
Mm-hmm.
Oh, yeah.
Yeah. So, I mean, when we talk about it's a gene, it's genetic, and then the other side of it, I, I'm in this unique scenario where I'm very familiar and comfortable around addicts and addiction because I've grown up around it, seeing it, knowing how it works. But then I also live in a world where there are people who truly think y'all are just lazy or losers or get your crap together. Why can't you stop drinking?
No willpower.
No willpower. What's
Right.
wrong with you? Because, some people are blessed. They don't have it. I'm married to a man who, if I told him today, don't take a drink for the next 5 weeks, he'd be like, okay, and be just fine doing it. But he can go out and have a good time, have a couple drinks like anyone else. But what's missing there, sometimes they forget not everyone has that luxury. And so it is very much a medical issue. And so one of the unique things with their center and part of the plan that he wrote was doing these brain scans where you can actually see a change in people's brains from trauma, but also the addiction. I don't know if you want to speak more to that.
Alcoholic, there aren't many of these left anymore, James, but a pure alcoholic is what they used to be called, where alcohol was their thing. They didn't dabble in other things.
Right.
An alcoholic who drinks every day for years, we do a brain scan on them, and this is called a SPECT scan. SPECT is SPECT, which is a technical term 3 feet long that at the moment I can't recall what it all stands for. It really doesn't matter, but it's a new technology, relatively new. It's like an MRI. The patient is injected with an isotope, and they can see and take cross images of the brain, horizontally, vertically, all parts of the brain, and develop an image from that. And when an alcoholic has one done, as I just described a moment ago, daily drinker for years, that brain looks like Swiss cheese. It's full of holes and blank spots. And that image is of neurotransmitter and blood flow activity. So there isn't any where those holes are.
Yeah.
It's gone. That's the damage that alcohol and drugs can do. Cocaine and heroin, worse. Marijuana, same as alcohol. Daily marijuana smoker, his brain is impaired.
Yeah.
And so that speaks to why 30-day treatment doesn't work very well. We do a SPECT scan at 30 days, the brain hadn't changed much at all.
Interesting.
At 90 days, it starts to look normal again. So what does that tell you? Blood flow neurotransmitter activity is back, and they're able to make better decisions for themselves.
So it's interesting. You said it took you 3 months.
Yeah.
Yep.
I learned something new today.
Yeah.
Single-Photon Emission computed
There you go.
tomography.
Thank you.
How did you forget?
Yeah.
Yeah.
Nuclear imaging test. Shows how blood flows to tissues and organs.
Yeah.
Yeah.
I tell you, if you're interested, Google Dr. Amen and look at his clinics and his SPECT, the use of SPECT scanning
That's
that he
interesting.
does.
I'm going to look into this
He
stuff. I love the brain is fascinating.
It
to me.
is.